Hello guys, this is Dr. Fatima Qureshi, and today's topic is a rare disease that I just saw in my clinic, and it's called Bechets disease. So a little brief background about Bechets disease. Is an inflammatory disease, and it causes vasculitis, which is inflammation of the blood vessels, major blood vessels such as arteries and the veins throughout the body. Sometimes we also call it a Behçet syndrome because there's so many organs that are involved. So I can tell you in my entire career, I think I just saw one case when I was in Illinois. And now I saw the second case here in Louisiana. So it's a pretty rare condition, but it's more commonly seen in Middle Eastern people. So in the Middle Eastern countries, and then in the Far East, such as China, Japan, you can also think about Korea in that area, and then some of the Mediterranean countries, such as Turkey. You can also see it in Iran, and also in Israel. So remember, Behçet's disease is more common in Middle East, in the Asian countries, and also in the Mediterranean countries. Sometimes it's also known as the Silk Road disease because in the ancient times, that was the trading route from the Far East to the Mediterranean area. So remember those things as well. Now, I saw the disease in a young female white girl, and she is in her teenage years. So that is kind of rare to see that in an American. In the US, it's not very common, but you know, there are rare cases that we see sometimes, and it does not fit the perfect textbook criteria. But she had a rheumatologist tell her that she had rheumatoid arthritis at the age of 12, I believe. So she had juvenile rheumatoid arthritis, and some of the things to remember with Behçet's disease is like the first thing that came to my mind as soon as she came to the room, to the exam room to me today. I was like, oh, do you have like oral ulcers, like ulcers in the mouth? That's the first thing that you're going to ask the patients. And her mom said, yeah, she's been having the oral ulcers, and that's ulcers in the mouth. And then they can also present with skin problems, and a lot of them present with big patches on the skin. They look like big acne marks also, and then there are nodular areas as well. So I did ask the patient, who is a young female, white American female, and she said she has those lesions on her skin as well. So those are the things to remember. And then the most important thing, the reason she came to me for her eyes, is because her rheumatologist had referred her to us from New Orleans. Actually, she was seeing a rheumatologist there who had referred her to us because Behçet's disease also presents with eye problems such as blurry vision. There could be redness, there could be pain, and we have to see if the patient has an inflammatory condition which is known as uveitis. Okay, so remember, Behçet's disease presents commonly with the oral ulcers, the mouth ulcers, and then the eye problems and skin problems. Now, when I examined the patient, she was not having any blurry vision today. She read perfectly, like 20/20, perfect vision with her glasses, so I wasn't too concerned about that part. Then I asked her about the pain part. I said, do you have pain in your eyes? And she said, sometimes she has like aching, throbbing ache in her eyes, but not particularly pain. So I checked her intraocular pressure. Her eye pressure was perfectly fine. Then I had to check her for uveitis. Uveitis is inflammation of the uveal tract, the uveal area. So I had to check her iris to see if she had any inflammation in that area, but her eyes look really nice and quiet. Her conjunctiva did not have any redness, the white part of the eye. So then I checked the interior segment of the eye where I can see cells and flare, which are typically you see them in inflammatory conditions such as uveitis or iritis, and she did not have that. And then I also dilated her because I wanted to check her macula and her retina, and I did not see any signs of inflammation. Now, also remember, in Behçet's disease, they can also present with arthritis and painful arthritis. So this patient does have arthritis, but she is also on Plaquenil, and she's on anti-inflammatory medicines as well. So because of the Plaquenil, which is hydroxychloroquine, it has a side effect of bullseye maculopathy. So I wanted to check her retina and her macula to make sure she does not have any signs of maculopathy, and she did not. That's it. That just it correlates with her vision being 20/20. So that was a good sign. So those are all the good things that I told the patient. But I told her and her mom that I'm going to call her back for visual field test, which is a 10-2 visual field test done, so that I can check her macula And the visual field is going to tell me if there's any maculopathy happening in that area. And then I will also check her macula more thoroughly with an OCT. That's the test that we do for the macula. So those are the good things. In her eyes, I didn't see any complications, and we sent the letter to her rheumatologist telling them that the eyes are looking fine. Now we come to the skin part. So she is being treated with anti-inflammatory medicines. She had a whole list of medicines, and one of them that she's using is a colchicine, colchicine, and she is using that because that is helping with the inflammatory part. And maybe I was thinking that's the reason that I did not see any active signs of inflammatory condition in her eyes. So that's a good sign also. Then she is on many other medicines. She's also on a lot of painkillers because her pain gets really aggravated. And she is also seeing a psychiatrist and a child psychologist because this condition, Bechets disease, can also present with psychiatric problems such as depression and also psychotic problems. So remember that as well. Now, Bechets disease is sometimes known as a Bechets syndrome because these patients can also present with other systems or other organs getting involved. So some of the organs that can get involved besides the eyes and the skin and some other parts of the GI, because this disease mimics other conditions as well. So the other organs that can get involved would be GI, gastrointestinal tract. Then they can also involve the kidneys, the lungs, which is rare, and then the brain can get involved as well, especially the brain meninges with the inflammation reaching that part as well. So some of the diseases that can look like or present like Bechets disease are the differential diagnosis list that we have to briefly mention as well here. So let's discuss that. Some of the conditions would be Crohn's disease, ulcerative colitis, it could be mimicking Reiter's syndrome, it can mimic sarcoidosis, which can affect the lungs. In this condition, in Bechets disease, it's very rare to see the lungs getting involved, but in sarcoidosis, that would be something that does get involved along with the eyes and the skin problems. So it does mimic sarcoidosis a little bit. Multiple sclerosis is another condition where the brain gets involved, the white matter in the brain. And in my patient with the Bechets disease, her brain scans have not been done, but at some point I will recommend a neurologist also seeing her, just to make sure that we are ruling out or making sure that we are looking into every organ of the body eventually. So those are the things to remember. And the patients with Bechets disease can present with not just mouth ulcers, but also genital sores as well. So now we're going to talk about some of the gene markers for Bechets disease. Her rheumatologist had already ordered these two markers, and these two are HLA-B5 and HLA-B51, and they came out negative. Now, a lot of doctors will get confused because they'll be like, okay, the gene markers are negative, so why are we calling it a Bechets disease? Well, a lot of times the gene markers could be negative and the patient can still have Bechets disease. So again, it becomes a little bit atypical. Not everything is going to be how it is presented in textbooks. The second thing that I wanted to ask the patient about the Bechets part is that does she have any other triggering factors? So I was reading in some literature that says that certain foods can also trigger the Bechets disease, such as pineapples, cheese, nuts, such as peanuts, almonds, and certain other foods. So that's something that her primary care doctor probably or rheumatologist can mention to her as well. Then Bechets disease is more commonly seen in males, and in our situation, in our case, it's not a male, it's a female, right? And then it's commonly seen in males between 30 to 40 or 30 to 50 years old, and my patient is a teenager, so again, it's atypical. So we discussed the gene markers, we discussed the main symptoms and the signs that the patients can present with, and then the treatment plan. Now, it's not a curable disease, but we can treat it symptomatically. So that's another thing I told the mom and educated her about that. And we're going to continue monitoring her. We're going to keep a good communication with her rheumatologist and maybe even psychologist and maybe a neurologist eventually, because she is having some depressive symptoms that are associated are commonly presented with Bechets disease. Her oral ulcers, the mouth ulcers, were not actively seen today because she is on anti-inflammatory medicines. I did not see uveitis in her eyes, but if she does have, because it can be recurrent, so the oral ulcers and the eye problems and the skin problems can be recurrent. And I told the mom and I told the patient, if they appear or if I see any signs of uveitis, active uveitis, then I'm going to treat her with steroid drops. Now, coming to the treatment, a lot of doctors are going to talk about corticosteroids, and this patient is not on corticosteroids. However, the mom did say they tried the corticosteroids on her, like prednisone, but she had a severe side effect. She couldn't take it, so they had to stop that. So the second best line of treatment in this condition, in the Bechets disease, in my patient, is colchicine. So that's what she's using, the colchicine medicine. And that's anti-inflammatory. Now, there are other immunosuppressants that can be also used, and my patient is on 2 immunosuppressants already. So her condition was not very drastic today. It did not appear to be very like full-blown condition today, but again, that's the whole purpose of having a whole team of doctors who will be monitoring her, and I will be monitoring her eyes. And so I thought it was a very rare condition, and it's not commonly seen in the US. And like I said, I saw only 1 case in Chicago, and other states where I have worked in other cities, I have not seen it. Like I never saw any case of Bechets disease in Boston. I didn't see anything in Arizona. And I just saw my first case here in Louisiana. So it's a rare condition, and I wanted to make a video to educate everyone about this condition. And never think that since the textbook is saying this condition is more prevalent in the Middle East or Far East or Asian countries, it can still present in America. There will be a few rare cases that we're going to see every now and then. So these are the things that we're going to monitor her on, and that's all about Bechets disease. Please read about it. And thank you. Take care. Bye.